me, my beautiful clinicians and very hardworking therapists who put their time and effort into their practice and patients. This week's topic is really going to be helpful, especially if you're working with people who have TBI and other conditions that may cause coma. I have been thinking of ways to put this together, but hopefully this will be the one that sticks and helps you throughout your practice or your board exam. You can also show it to your patients' family members, or caregivers to learn from this video.
I had some lovely people ask me on Instagram to please post about Ranchos Los Amigos. This wasn't really an easy topic to put together because there's so much information composed in so many different levels. I've decided to use the most vital information that would be needed for the exam and for work purposes as well as practice clinicals. I will go through them one by one. However, on the next slide, you will see all 10 of them. As you can see here, the Ranchos Los Amigos scale of cognitive functioning is here from level 1 till 10. It's just a compile of everything that we'll be going through. Don't overwhelm yourself. We will go through it together. Hopefully, by the end of this video, you won't need to memorize anything. It'll just stick with you while you take the exam or do some practice questions, as well as work with patients who had traumatic brain injury. Oh, we have Snow White here. Of course, she didn't have a traumatic fall, but in this case, we'll make believe she did. What happens to her in the real Disney story? She's offered an apple by the Wicked Witch, who says, "Here, Snow White, try some apple." And at first, she looks at the apple, she doesn't eat it, right? Then she decides to eat the apple and she bites into the apple and boom, she falls on the floor. Little did she know that she would get poisoned. If she would have known that she would get poisoned, she would never eat it. But in this case scenario, we will make believe that Snow White just decided to eat the apple. And she had a bad reaction to it, hit her head against the bed or something that was really hard, causing her to have a traumatic brain injury. In the case of this one, for level 1, Snow White doesn't remember anything, she doesn't have any response, and she's in complete coma. What typically happens at this level is she will appear asleep and unable to respond to anything. She definitely needs assistance with, ADLs, IADLs. Throughout the PowerPoint, you will see red letters or red highlights or different types of colors. It's like a hint for you to remember each level. So for level 1, NTC, N for no response, T for total assistant, and C for coma. As you can see here, Snow White is lying in her bed. This is level 2, generalized response. She definitely needs total assistant and she only responds to pain during this level, and it could be gross reflex response as well as other painful responses. She also has inconsistent and non-purposeful reaction to stimuli. All right, level 3. This is the localized response, which requires total assistance. She reacts to stimuli through inconsistent response to commands. She blinks to strong light, turns toward or away from sound. She may be able to also track a moving object. For instance, let's say she heard one of the 7 dwarfs say something to her, she would, of course, turn towards them and start smiling. One of the things that the therapist can do during this level is ask the client, who is Snow White, if she would like to have some food by squeezing their hand. And if she squeezes the hand of the therapist, then definitely the therapist knows she's able to respond. Level 4, this is where Snow White is confused and agitated. As you can see in the video, she was like twirling and twirling and twirling and twirling. She's confused as to what's going on and what happened to her. So she's definitely uh, having a decreased ability to process information during this level, and she's unable to orient herself to time, person, and place. She doesn't know where she is and what's going on. She's very confused. She tries to climb out of bed and she acts aggressively. For example, what can happen is she can hit someone, like one of the dwarfs, who's trying to help her get dressed. So during this level, a therapist may need to help her with simple instructions, such as, you know, Snow White, can you please brush your hair? So, how would she brush her hair? You would give her a picture with object identification. Here is a brush. You might even need to like label it, say, this is the brush that I use for your hair, not a toothbrush, so she doesn't get it confused. Sometimes at this level, the patient may get confused, especially when they're coming back to themselves. Her attention span is only available for a few seconds. So you provide her with limited distractions and simple routines. Level 5, confused, inappropriate. As you can see, Snow White is confused. There's so many different types of animals in the room. So she's like, okay, let me just do what I have to do. In regards to this, she appears alert with fair, consistent. She requires maximum assistance. She may also be confused when provided with a toothbrush, which she may use for her hair instead of brushing her teeth. So it's very important to provide her with familiar tasks with enough structure. She's severely impaired with short term memory. In this case, she would need step by step directions. She will also need to fill in the gaps for memory, stay calm, repeat things over and over, try keeping her organized and getting into an activity. What can really help her is personalized items with her memory. And level 6 is confused and appropriate. With moderate assistance, she will be able to get things done. In this case, she's dependent on external input direction, goal-directed behavior, moderate assistance, like I mentioned earlier, is needed, and she can perform activities for 30 minutes. Level 7, automatic and appropriate. At this stage, she behaves appropriately. She's oriented to place and routine, displaces shallow recall. She requires minimal assistance, unable to determine the consequences of their actions, acts like a robot, so she's unable to determine her consequences. Level 8, purposeful and appropriate, can complete tasks for up to an hour, even in a distracting environment. She's alert and oriented, recall the past and recent events. So this requires standby assistance. Attention span could take up to 2 hours, sometimes more, depending on what level she may be in. She's also able to determine the consequences of her actions, may need extra time to solve problems. These are the stages of OT treatment planning. For stage 1, which is coma, Ranchos Los Amigos levels 1 through 3, you need to use as a therapist sensory stimulation and reality orientation, massage, music, aromatherapy to help the client be aware of her surroundings. Stage 2 is confusion, goal directed Ranchos Los Amigos levels 4 to 6. You minimize the environment, overstimulation, and you provide her with ADLs through repetition. Stage 3 is cognitive behavioral rehabilitation Ranchos Los Amigos, levels 7 through 10. She'll be able to do home management, work and leisure, compensatory strategies, and time management. These are the main things that an OT needs to do for these 3 stages. So if you can remember the ones that are highlighted, then you'll definitely know what to do. Oh, Snow White just woke up. Do you hear that sound? She's so happy that she received all her OT treatments. Now she's feeling great and she's ready to take on the world. Good job, Snow White. I'm very proud of you. Here are the references. I hope this helped a lot. I hope to see you back on my next YouTube channel.
Thank you so much for watching. I hope this video helped you. I also hope this video brought you insight on different steps of this condition and what to do in each step, especially for someone with coma. Please like, share, and subscribe if you haven't yet. Also, please make sure to share with your colleagues, patients, and their caregivers. Thank you.